Uneasy lies the head that treats the balding crown. In hair transplant surgery, the crown remains an enigma. The presence of a large bald crown is very disconcerting to the hair transplant surgeon. And this remains so because of paucity of grafts. The donor area is limited, and hence covering the crown is a severe challenge to the best hair transplant surgeon in the world. It is natural for most hair transplant surgeons to be conditioned to treating the hairline, the temple points, and the mid scalp because that's what we are taught in several society meetings, in workshops, in one to one interactions, and in observations. That is what we think most of the patients want. Most advertisements, most promotions on internet are of hairline. So when the hairline should be getting all the attention as we are conditioned to think, as we are conditioned to plan a surgery, so when we encounter a large bald crown, it unsettles us. Initially, when we start a career as a hair transplant surgeon, we are overawed by the crown. That hair transplant surgery has its fallibility, its failing. It cannot cover all areas like a natural head full of hair. And many times, this is what the patient wants, and this is what, in many cases, when the balding crown is very large in proportion, we are unable to deliver. Many a times after counseling, we have drawn an artistic hairline, framed the face very aesthetically by restoring the temple points. And when we oversee the geometry that we have drawn on the patient's head, and just when we're beginning to gloat over it, the patient begs to differ. He does not want us to spend all our skills and artistry on the hairline. Many of us have encountered the patient telling us that, "Doctor, the hairline is fine with me. I can remain bald in the front, but what bothers me most is the bald crown. So that's where I want the hair to be filled." To be very honest, most of us have gone through this experience with the patient. And in such cases, when the patient wants priority to be given to the crown area, many would clench their teeth in indignation, not knowing how to plan the procedure or what to say, because we've not been taught how to approach the crown so well as we have to treat the hairline. Many years ago, I was taught by a senior hair transplant surgeon in Michigan that the balding head is like the nation or a state. There are two authorities in the balding head. One is the temporal authority, and he referred to it as the temples, and the other one is the crown or the king. And they go hand in hand. You can't separate the two. So when you plan a hair transplant surgery, you have to give them equal importance. So with this, he meant the management of the hairline and the crown are equally important to the patient. We might think that the temporal authority is more powerful, or some may think that the crown is more powerful, but both have a place in the overall management of the balding head. A person with a balding crown is also likely to have temple points which are effaced. It is very rare to see a patient with full blown temple points who has a balding crown. Well, exceptions are always there, but mostly a good temple point denotes a healthy crown area. And the corollary is also true. Whenever a patient has a large balding crown, you will also find that his forehead is becoming wider. The forehead becomes wider in dimension, in the vertical dimension as well as in the horizontal dimension, because the temples and the temple points have got effaced along with the hairline. Over a period of time, I have come to note that the crown sets the pace of extensive baldness. The crown gradually eats into the permanent donor zone, slowly gnawing at its fringes and surreptitiously infiltrating the permanent donor zone, causing miniaturization. It is like one bad apple that spoils all the other apples that are lying next to it. If the management of the hairline is all about artistry and skill, the management of the crown stretches the quality of your planning, the ability to foresee the extent of baldness on the one hand, and your qualities of patience and forbearance on the other. So this is the importance of the balding crown. The balding crown sets the pace of extensive baldness. The pattern of the balding crown determines the geographical direction of the baldness which you will get as baldness progresses. So this is the importance of the crown. This is the importance of the crown in determining the progression of baldness. And since the baldness of the crown is so extensive that it far outstrips the availability of grafts needed for its coverage. So this is the reason why it's called the black hole of hair restoration surgery. So as I conclude this talk, in this picture you can see if there was one black hole, if there were two black holes, what would happen? So the presence, the morphology, and the amount of thinning of the crown determines the availability of grafts, it determines the suitability for hair transplant, and it determines the overall happiness that the patient is going to get through hair transplant surgery. Thank you for watching, and if you have any questions about hair transplant in general and crown in particular, please leave a comment below and I'll be too happy to reply back to you, and God bless you.